Hello students, as we all know, cells divide to grow and repair tissues. Now division of cell is a highly controlled process. Now cancer is a disease that arises due to rapid, abnormal, uncontrolled multiplication or proliferation of cells. Now anti-cancer drugs inhibit this uncontrolled, excessive multiplication of cells. So in today's video, we are going to study pharmacology of antimetabolites. Now antimetabolites is a very important, a very useful class of anti-cancer drugs. Now antimetabolites interfere with the synthesis of DNA. Now these are cell cycle S phase specific drugs. And during the S phase, DNA is replicated. So by inhibiting DNA synthesis, these drugs prevent DNA replication and thus the cell cannot divide and thus the rapid multiplication is controlled. Now as we all know, for synthesis of DNA, nucleotides are required. Nucleotides are the building blocks of DNA and each nucleotide is made up of a sugar, a base and a phosphate group. Now bases can be purines or pyrimidines. So now let's study the classification of antimetabolites. Now antimetabolite drugs are classified in three major groups. Now the first class is folate antagonist. Folate antagonists inhibit synthesis of purines and pyrimidines. Drugs are methotrexate and pemetrexate. Now pemetrexate is a congener or derivative of methotrexate. Second class is purine antagonist. These drugs prevent synthesis of purines, namely adenine and guanine. Drugs are 6-mercaptopurine, 6-thioguanine, azathioprine and fludarabine. Then third class is pyrimidine antagonist. Drugs included in this class are 5-fluorouracil, capecitabine, cytarabine, that is the cytosine arabinoside. So this is a classification of antimetabolites. In order to understand mechanism of action of antimetabolite drugs, let's first understand process of DNA replication. Now look at this figure. It explains the process of DNA replication. Now before a cell divides, DNA replicates. Now for the DNA replication, an enzyme known as helicase is very essential. Now this enzyme helicase, it separates the double-stranded DNA into two single strands, and these two single strands are called as the parent strands. Now these parent strands, they act like template for the synthesis of new DNA strands. Now another very important enzyme is the DNA polymerase. Now this DNA polymerase it reads the parent DNA strand and accordingly it adds complementary nucleotides to the newly forming DNA strand. Now here it's very essential to remember that it is the adenine that pairs up with the thymine and guanine that pairs up with the cytosine. So before a cell divides, its DNA replicates. These are the replicated DNA and it makes copy of its genome. Now if the enzyme DNA polymerase is inhibited, then nucleotides these nucleotides, they will not be added to the newly forming DNA strand and this will prevent the process of DNA replication. So this is the process of DNA replication. Now let's study pharmacology of different classes that are included under the group antimetabolites. Now the first category of antimetabolites are the folate antagonist, and the first drug is the methotrexate. Now methotrexate is a folate antagonist and it is a very useful, highly efficacious anti-cancer drug. Now methotrexate is transported inside the cell by reduced folate carrier. Now once inside the cell, it is transformed to a more active methotrexate polyglutamate form by the enzyme polyglutamate synthase. Now as we know that for the DNA replication, nucleotides are very essential. Now methotrexate inhibits the enzymes required for the synthesis of purine and pyrimidine nucleotides. Now let's first talk about the de novo pyrimidine synthesis. Now this is a reaction. It shows the synthesis of pyrimidine nucleotide, that is the deoxythymidine monophosphate. Now, during the synthesis of deoxythymidine monophosphate, this deoxyuridine monophosphate is converted to deoxythymidine monophosphate by the enzyme thymidylate synthase. Now, besides this enzyme, during this reaction, a cofactor, that is N5N10 methylene tetrahydrofolate, is very essential. And during this reaction, this cofactor, that is N5N10 methylene tetrahydrofolate, is converted into dihydrofolate. And an enzyme, that is the dihydrofolate reductase, it regenerates this N5N10 methylene tetrahydrofolate from dihydrofolate. Now, methotrexate inhibits the enzyme thymidylate synthase, and it also inhibits the enzyme dihydrofolate reductase. So, inhibition of these two enzymes prevent the synthesis of deoxythymidine monophosphate, that is prevents the synthesis of pyrimidine nucleotide, that is essential for the synthesis of DNA. Now, besides acting as a cofactor, this N5N10 methylene tetrahydrofolate also acts as a coenzyme during de novo purine synthesis. Now, methotrexate by inhibiting the enzyme dihydrofolate reductase prevents the regeneration of N5N10 methylene tetrahydrofolate. So, deficiency of this N5N10 methylene tetrahydrofolate prevents the synthesis of purine nucleotides, namely deoxyadenosine triphosphate and deoxyguanosine triphosphate. Thus, methotrexate by inhibiting the enzyme thymidylate synthase and dihydrofolate reductase inhibits the synthesis of pyrimidine nucleotides and purine nucleotides that are very essential for the synthesis of DNA. So, this prevents the replication of DNA. Methotrexate, as discussed, is a S-phase specific drug, and by inhibiting the synthesis and replication of DNA, it reduces the proliferation of cancerous cells. So, this is the mechanism of action of methotrexate. Now, indications of methotrexate. Methotrexate is indicated in choriocarcinoma. It is highly effective in maintaining remission or providing recovery in children with acute leukemia. It's widely used in non-Hodgkin lymphomas, breast, bladder, head and neck cancer, osteogenic sarcoma. And methotrexate is a prominent immunosuppressant that is useful in autoimmune diseases like rheumatoid arthritis, psoriasis, etc. Then major toxicities of methotrexate: it causes myelosuppression, that is bone marrow suppression. Low doses given repeatedly cause megaloblastic anemia, while high doses produce pancytopenia, causing decreased count of red blood cells, white blood cells and platelets due to folate deficiency. Now, leucovorin or folinic acid, that is N5-formyl tetrahydrofolic acid, can be given with the methotrexate to reduce the severity of myelosuppression. Another major adverse effect is the mucositis, that is inflammation of mucosa that can cause oral ulceration and diarrhea. These are the common adverse effects of methotrexate. Desquamation, that is peeling of skin, and bleeding may occur in the GIT. Birth defects like neural tube defects can occur due to folate deficiency. So, this is the pharmacology of methotrexate. Another folate antagonist is the pemetrexate. Now, pemetrexate is a new congener or a new derivative of methotrexate. Now, like methotrexate, it also inhibits thymidylate synthase and dihydrofolate reductase, thereby reducing the synthesis of pyrimidine nucleotide, that is deoxythymidine monophosphate. Now, in comparison to methotrexate, it causes reduced deficiency of tetrahydrofolate. It is a S-phase specific drug, and it reduces DNA synthesis, thereby reducing the DNA replication and prevents the excessive multiplication of cancerous cells. It is indicated in the treatment of mesoepithelioma and non-small cell lung cancer. Now, toxic effects include painful itching, then erythematous rashes. Now, these rashes are commonly seen on the hands and the feet. Now, like methotrexate, it also causes myelosuppression. Now, low dose folic acid and vitamin B12 pre-treatment can reduce the incidences of myelosuppression. It also causes mucositis and diarrhea. So, this is the pharmacology of folate antagonist pemetrexed. Now, after folate antagonist, next category of antimetabolites are the purine antagonist. Now, adenine and guanine are the purine bases. Now, here we are going to discuss pharmacology of 6-mercaptopurine and 6-thioguanine. Now, both these drugs are highly effective anti-cancer agents. Both of them have similar mechanism of action. Now, these drugs inhibit synthesis of purine nucleotides, and let's study here the mechanism of action of mercaptopurine in detail. Now, 6-mercaptopurine is activated by the enzyme HGPRT to thio-IMP, that is thioinosine monophosphate. Now, enzyme TPMT, that is the enzyme thiopurine S-methyl transferase, further methylates thio-IMP to methyl thio-IMP. Now, this methyl thio-IMP, it is a potent inhibitor of enzyme amidophosphorybosyl transferase, an enzyme required for the de novo purine biosynthesis of adenine and guanine. So, therefore, it is the methyl thioinosine monophosphate that inhibits the synthesis of adenine and guanine. So, this is how the purine nucleotides are not synthesized. Now, besides this, this thio-IMP, it is converted to thio-XMP, and then further it is converted to thio-GMP. Thio-GMP is thioguanosine monophosphate. Now, the enzyme kinases, they phosphorylate this thio-GMP, that is the guanosine monophosphate, to thioguanosine triphosphate. So, GMP is phosphorylated to GTP. So, thio-GMP is phosphorylated to thioguanosine triphosphate. Now, this thioguanosine triphosphate, it gets incorporated in the DNA in place of the normal guanosine triphosphate nucleotide, and this causes the formation of or this produces dysfunctional RNA. Similarly, this thioguanosine monophosphate is phosphorylated, as well as it is reduced by the reductase enzyme to produce thiodeoxyguanosine triphosphate. Now, this thioguanosine triphosphate, it gets incorporated in the DNA in place of the normal deoxyguanosine triphosphate nucleotide. So, this also produces dysfunctional DNA. So, 6-mercaptopurine and 6-thioguanine are the S-phase specific drugs. They inhibit the synthesis of DNA, thereby they prevent the replication of DNA. On one hand, they inhibit the synthesis of adenine and guanine, and on the other side, they get incorporated in the RNA and DNA, resulting in the formation of dysfunctional RNA and dysfunctional DNA. So, this is the mechanism of action of 6-mercaptopurine and 6-thioguanine. Now, the full form of all these enzymes which are used in this reaction are given over here. Now, indications of these drugs. 6-mercaptopurine and 6-thioguanine are useful in childhood acute leukemia, then choriocarcinoma and some solid tumours. Now, few important considerations with respect to 6-mercaptopurine. Now, 6-mercaptopurine is metabolized by the enzyme xanthine oxidase. Now, a drug allopurinol inhibits the enzyme xanthine oxidase. So, co-administration of allopurinol along with 6-mercaptopurine inhibits metabolism of 6-mercaptopurine and increases its toxicity. Now, 6-thioguanine is not metabolized by xanthine oxidase. Then TPMT, that is the thiopurine S-methyl transferase, also metabolizes 6-mercaptopurine by inducing its methylation. Now, main toxic effect of these drugs is bone marrow depression, then nausea and vomiting. Now, 6-mercaptopurine causes more nausea and vomiting compared to 6-thioguanine. Now, 6-mercaptopurine also produces high incidences of reversible jaundice. Hyperuricemia occurs with both the drugs, and toxicity of 6-mercaptopurine increases with the concurrent administration of allopurinol. So, this is the pharmacology of 6-mercaptopurine and 6-thioguanine. Now, another very similar antagonist is azathioprine. Now, azathioprine is a prodrug of 6-mercaptopurine. But the difference between the two is this, that azathioprine is selectively taken up by the immune cells. So, azathioprine inhibits the DNA replication in the immune cells. So, azathioprine reduces multiplication of immune cells, and thus it has potent immunosuppressant effect, and azathioprine is mainly used in the treatment of autoimmune diseases like rheumatoid arthritis, ulcerative colitis and organ transplantation. Now, another purine antagonist is the drug fludarabine. Now, fludarabine is a prodrug. So, inside the cell it is phosphorylated to its active form, that is the fludarabine triphosphate. Now, for understanding the mechanism of action of fludarabine, we should know the function of few important enzymes which are required for the synthesis of DNA. Now, first very important enzyme is the DNA polymerase. As we have already studied, this DNA polymerase, it reads the parent DNA strand and it adds the complementary nucleotides to the newly forming DNA strands. So, it is very essential for the replication of DNA. Then another enzyme that is the ribonucleotide reductase. What it does is this, that it converts the ribonucleotides to deoxyribonucleotides. For example, AMP, that is adenomonophosphate, is converted to deoxyadenomonophosphate. Then GMP, that is the guanosine monophosphate, is converted to deoxy guanosine monophosphate. And both deoxy-AMP and deoxy-GMP are the nucleotides for the synthesis of DNA. Then another enzyme, that is DNA primase. Now, this DNA primase is required for the synthesis of short RNA sequences. Now, these short RNA sequences are very essential for initiating the synthesis of new DNA strands. So, all these enzymes are very essential for DNA synthesis and replication. Now, fludarabine triphosphate blocks DNA primase. It inhibits ribonucleotide reductase and it also inhibits DNA polymerase. So, it inhibits the enzymes that are required for DNA synthesis and replication. Now, besides this, fludarabine also interferes with the DNA repair, and it also gets incorporated in the newly forming DNA strands, and that results in the formation of dysfunctional DNA. So, all these functions of fludarabine prevent the DNA synthesis and replication, thereby it controls the excessive multiplication or proliferation of cancerous cells. So fludarabine is also S-phase specific drug. Now indications of fludarabine. Now fludarabine is indicated in the treatment of chronic lymphatic leukemia, then non-Hodgkin lymphoma, non-Hodgkin lymphoma that has reoccurred after the treatment. Then adverse effects of fludarabine are myelosuppression. Then it can cause chills, fever, myalgia, that is muscle pain, arthalgia, and vomiting after its injection. Then it can also result in the opportunistic infections because it is a potent suppressor of cell-mediated immunity. So this is the pharmacology of purine antagonist fludarabine. Now after folate and purine antagonist, next category of antimetabolites are the pyrimidine antagonist. Now cytosine, thymine and uracil are the pyrimidine bases. Now here we have two drugs, fluorouracil and capecitabine. Now first we are going to study the pharmacology of drug 5-fluorouracil. Now 5-fluorouracil is a prodrug. It is taken up inside the cell, and inside the cell 5-fluorouracil is converted to fluorinated nucleotide. It is converted into fluorodeoxyuridine monophosphate, that is FDUMP, and fluorouridine monophosphate, that is FUMP. Now very important, this fluorodeoxyuridine monophosphate, it forms covalent bonds with the thymidylate synthase and with the cofactor, that is the N5-N10 methylene tetrahydrofolate. So complexation of this enzyme and complexation of this cofactor prevents the conversion of deoxyuridine monophosphate to deoxythymidine monophosphate. So in this way 5-fluorouracil inhibits the synthesis of deoxythymidine monophosphate, a nucleotide that is very essential for the synthesis of DNA and DNA replication. Now besides this fluorodeoxyuridine monophosphate, it gets phosphorylated to fluorodeoxyuridine triphosphate, and this fluorodeoxyuridine triphosphate, it gets incorporated in the DNA that is being formed, and thus it damages the DNA. So this is how this fluorodeoxyuridine monophosphate, on one hand it inhibits the synthesis of nucleotide, and on the other hand it damages the DNA. Now on the other side, as we have discussed, this 5-fluorouracil, it is also converted into fluorouridine monophosphate, that is FUMP, and FUMP is further phosphorylated to FUTP, and this FUTP, it gets incorporated in the RNA, and thus it damages the RNA. So 5-fluorouracil, by inhibiting the synthesis of deoxythymidine monophosphate, that is the nucleotide of DNA, inhibits the synthesis of DNA, it inhibits the replication of DNA. It is a S-phase specific drug, and by inhibiting the DNA replication, it prevents the multiplication and proliferation of cancerous cell. Now besides this, it gets incorporated in the DNA as well as in the RNA, and it damages the DNA as well as the RNA. So this is a mechanism of action of 5-fluorouracil. Now very important, concurrent infusion of leucovorin, that is folinic acid, along with the 5-fluorouracil enhances the efficacy of 5-fluorouracil. So this is the complete mechanism of action of 5-fluorouracil. Now very important, oral absorption of 5-fluorouracil is unreliable, and therefore it is primarily given by IV infusion. Then indications of 5-fluorouracil. 5-fluorouracil is commonly used for colon, rectum, stomach, pancreas, liver, urinary bladder, and head and neck cancer. Now besides this, 1% topical solution of 5-fluorouracil is used for the treatment of superficial basal cell carcinoma and in actinic keratitis. So, these are the indications of 5-fluorouracil. Now, let's discuss toxicity. Now, 5-fluorouracil causes myelosuppression, that is bone marrow suppression. Then mucositis. Mucositis is the inflammation of mucosa. It also causes diarrhea, nausea and vomiting. Then peripheral neuropathy. Peripheral neuropathy is a rare complication of 5-fluorouracil. Then it can also cause head-foot syndrome, that is a skin reaction that causes redness or swelling on the palms of hands and soles of the feet. Now, 5-fluorouracil is metabolized by dihydropyrimidine dehydrogenase. So, deficiency of this enzyme dihydropyrimidine dehydrogenase increases plasma concentration of 5-fluorouracil and increases its toxicity. So, this is the pharmacology of 5-fluorouracil. Now, another pyrimidine antagonist drug is the capecitabine. Capecitabine is a orally active prodrug of 5-fluorouracil. It is indicated in the treatment of metastatic colorectal carcinoma, that is the metastatic colorectal cancer, and it is also used as a second line treatment for the management of metastatic breast cancer. Then like 5-fluorouracil, it can also cause head-foot syndrome and diarrhea. Bone marrow depression and mucositis are less marked with the capecitabine. So, this is a pharmacology of 5-fluorouracil and capecitabine. Now, another pyrimidine antagonist is the cytarabine. Cytarabine is cytosine arabinoside. Now, in the cell, cytosine arabinoside is phosphorylated to cytosine arabinoside triphosphate. Now, on one hand, this cytosine arabinoside triphosphate inhibit the enzyme DNA polymerase, while on the other side, cytosine arabinoside triphosphate also gets incorporated in the DNA. Thus, cytarabine prevents the proliferation of cancer cells by inhibiting synthesis of DNA. It is a S-phase specific drug. It is administered either by the rapid IV injection or continuously by IV infusion. Now, cytarabine is indicated in the treatment of leukemias, especially acute myelogenous leukemia and lymphomas. Now, major toxicity of cytarabine is the bone marrow suppression that causes leukopenia, thrombocytopenia and anemia. Then cytarabine also causes mucositis and diarrhea. So, this is a pharmacology of antimetabolite drugs used in the treatment of cancer. Please note, information provided in this video is only for the academic informative purpose. For the use of any of these drugs or for the treatment of cancer, consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.